what if like you're just listening to the this episode and you're literally just going into an IVF cycle? Is it okay to completely revamp your diet like in midstream of something? We're talking about endometriosis, and then we're also talking about like there's a lot of people that don't know they have endometriosis, or they have certain things going on. They may not have endometriosis, but still our conversation is going to be super relevant. So tell us more, like let's start in with the endometriosis itself, and then let's explain why it's relevant for every woman.
Sure. So endometriosis, we talked about it in our last episode with Dr. Sharma, and she went through diagnosing it from a Western perspective. Actually, not in our last episode, 2 episodes ago. Yes. And then last episodes, we talked about it from a TCM, or traditional Chinese medicine perspective. And it's relevant because many women have endometriosis, don't know it. They may be going through the fertility world, getting treatments, and then uncover it with the diagnosis, either an ultrasound and see, oh, they have endometriomas, or perhaps it's, there's struggles getting pregnant or staying pregnant, and it can impact, egg quality because of the inflammation, or oxidative stress associated with it. So generally speaking, as humans on planet Earth, we want to keep inflammation low. So it's relevant to everybody because we do, in general, we want to keep inflammation low, and we also want to keep oxidative stress low. So people might be like, what's oxidative stress?
Yeah. And I would like to add in, and that now is actually relevant for men and women. So, you know how we always like talk about the women. Well, guess what? Men are not immune to inflammation. If anything, there's a lot of men walking around with inflammatory issues. And when women go to the fertility clinic, there's just this giant focus on the woman. And it's like, well, how about your guy?
Yeah,
right?
No, absolutely. And metabolic syndrome is a big deal these days. Metabolic syndrome being where a person is developing prediabetes or symptoms of inflammation, high lipids, so high cholesterol, maybe their waist circumference is a little bit higher. So condition that kind of can lead to diabetes. And so with that, we want to target inflammation, oxidative stress, which it would help endometriosis and any woman who's ovulating and even beyond, because we tend to get more oxidative stress and inflammation with age.
Yes.
The longer we live on Earth.
Yes. So, and I, if you don't mind me adding into, when we look at oxidative stress and you look at it outside of your body and in terms of like machinery, if you look at a bicycle, if you look at a car, oxidative stress, what happens to the metal? Rust.
Right.
Yes. So I always equate it to, it's like your own internal body rust. Yuck, right?
Yes. No, that's actually a really good analogy. I will often say, cut up an apple, rub lemon on one side, and then leave that apple to sit. And what happens to the side that you don't rub lemon on? Rub lemon on. That's a tongue twister.
Yes. Yes.
You see browns the other side,
yes.
right?
Oh my gosh. Okay. Yeah. This is a total aside. Mm-hmm. My daughter shared this secret, and it's the most amazing thing. So you stick, I'll cut apple slices.
Yes.
And then I'll stick it in the sealed container. And it's not about rubbing the lemon even. You just stick a wedge of lemon inside without doing anything. And it prevented it from browning. And when you eat it, it was like, it's got like a little
lemon aroma.
Lemon. Yeah.
But without excess.
No, it was so good. And it's extra crispy. And
thank you, Zoe.
So fresh.
Yeah.
Awesome. And nice. It's not like, I now see like IKEA or her school, sometimes they'll give them sliced apples, but it's in a package and it's got additives, right? So this is a total natural way of doing it. It's awesome. Keeping it fresh. Anyway, that's very cool. Aside.
Yes, no, wonderful aside. So with endometriosis, we know that it can be it is an inflammatory condition, which is why a lot of women will suffer from menstrual cramps. Did you have menstrual cramps when you were menstruating?
No, not at all.
That's amazing.
Yeah.
So I discovered, because of menstrual cramps, I mentioned in a previous episode that, I didn't have endometriomas though. So I didn't have the most common area to have endometriosis, which is on your ovaries. They discovered on my ligaments, my uterosacral ligaments, which is this uncomfortable internal exam, and they discovered it that way. So at
wait. So tell people what the heck that is, right?
Like, it's so not comfortable. So I actually had a resident do it too. So they insert gloved fingers into the vaginal canal, and they go next to the cervix, and they take their fingers to check the uterosacral ligaments, and there's little nodules on there. And if there's no nodules, it's no endo. If there's nodules, it's endometriosis. It's very uncomfortable because you have to kind of go in deep to assess. And I'm like,
everybody's watching. Okay, good thing it's a podcast, because like you're literally like giving us a little show and tell. Not with her body though, guys. You know, we are like, this is not an X-rated podcast.
Yeah. So unfortunately there's no ultrasound that can do that. So, and I didn't, and you know, if you want the gold standard, which is a laparoscopy, you actually have to do in little tiny incisions, and they blow up the abdomen with air. And I was like, oh, I just don't want that. And then obviously now they don't do it without doing the surgery to remove. And I thought, you know what, the research shows that the surgery doesn't necessarily improve your chances of fertility, and it could affect fertility. So at that point chose not to do it. And at that point, I wasn't even looking to make babies. I was actually dealing with severe menstrual cycle pain. So
if we want to just get back to that conversation about laparoscopy, not laparoscopy, you guys just go check out our interview with Dr. Sharma, because we went into it extensively. All right. So back to,
uncovering, like, if you even have it, because some people think, oh, I don't have it. And they want to know there are ways to discover, you know, beyond a laparoscopy. There's that receptive test that we talked about.
Yes, that's right.
Episode. Yeah.
Well, but you know, at the end of the day, and in Chinese medicine, it's like, yes, it's a nice to have if you have a diagnosis, but really we want to look at symptoms if you have any, and we treat that. And, you know, what is the overarching issue that is going on with or without a diagnosis? It makes no difference. Like we treat anyway, despite
100%. Right? Yes. And the goal is, so, I mean, and when I was doing acupuncture, nutrition changes in clinic, I would see patients regularly for acupuncture, as you do, and they would say the acupuncture made such a huge difference with their menstrual cramps. And we talked about that in our last episode, how it improves the movement of qi. Now, through nutrition, there is a lot that you can do. And according to the literature, there is information on gluten being like gluten removal as being helpful. So if women in studies, they've been studied to show that if you remove the gluten from their diet for at least 8 months, there's a big difference, like 70% improvement. So there's conflict in the, you know, conflicting messages in the literature though, about dairy and about gluten. So, you know, biased studies. So it's very confusing. So it's very important to individualize treatments.
Okay. So can we just go take a deep dive into this? Because that's exactly what we need to talk and speak to, because this is, you know, important. It's one thing like going to a practitioner, but you're not going to do that 24/7. And so it's really looking into your own lives and how are we directing women when they're having these issues? So it's, and that is that question. Do I do gluten-free? Do I not do gluten-free? Do I do 70, 20, 30? Is that enough? And so let's speak to this. Okay. Let's start with gluten and then we'll do the dairy. Is that good for you?
Absolutely. Yeah. So, or generalize as well a little bit, because when a patient comes in, I look at their whole history. And if they have inflammatory or irritable bowel, let's first say, for example, where they're alternating diarrhea and constipation, then I will, you know, with the endometriosis or other coexisting conditions, which often do occur, like Hashimoto's thyroiditis, so an underactive thyroid, or they might be bloated the whole way through the menstrual cycle, not just have menstrual cramps. Sometimes I wonder, is that because they have endometriosis lesions around their bowel, or is it because in general, endometriosis is an inflammatory condition? Or is it that the nutrition is making the endo worse and, you know, just creating more inflammation, because food can be thy medicine, you know? So the gluten for specifically, I will often say if somebody comes in with irritable bowel and endometriosis, or if they've had a lot of struggles kind of with implantation, if they're going through fertility, for example, then I'll say, let's do the anti-inflammatory or hypoallergenic diet, which is removing dairy and gluten and sugar and then eating whole grains that are gluten-free. So it's not just that you're going to kind of eat gluten-free, products, because then your glycemic index goes up, right? A lot of gluten-free products, for example.
So important.
Right. Yeah. Like if you have like gluten-free white rice bread or white rice pasta, that's not good for you either. It's important to go to whole foods. So generally speaking, the Mediterranean diet, tailored to different cultures, or the concept of that healthy, happy plate, like half the plate whole, half the plate vegetables and dark green leafy type vegetables, and then a fist of healthy carbohydrates that would be in this example gluten-free, not just, again, a gluten-free product. It would be sweet potatoes, carrots, yams, brown rice, quinoa, all the gluten-free grains
that are naturally occurring. So let's be clear about that.
Whole form. So
yes,
you're not necessarily having like a piece of rice bread. Instead, you're eating brown rice, preferably over white rice, for example, as well.
So important to add this in, because I have to tell you, because as a person shopping, it can be confusing because marketing is really good out there. So when you see, oh, this is great, this is a gluten-free product, so then surely that must be good for you. And and most of those kinds of products, literally products that have been processed, they're actually really high in glycemic index. They're just basically you're like eating sugar.
Right. 100%. So it's always best to stay on the outside aisles, right? Where the fresh produce is, seafood and the meats. And then you've got, you can go to bulk barn for your grains, or you can have fresh root vegetables and legumes, or even the canned beans, to be honest, for the people who don't have the time to soak the beans long enough, because otherwise you can get very gassy if you don't cook the beans properly. And, yams and root vegetables. And there's so many different types of root vegetables. People often just have potatoes, but there's a variety, and turnips and all the starchy veg, right? So the starchy vegetables, the legumes, the whole grains that are gluten-free, that's like a fist on your plate, half the plate, fresh vegetables. And if you have, issues with eating raw vegetables, because let's say, for example, you get a lot of loose stool, and in Chinese medicine, we're trying to also like kind of warm up give you cooked foods, right? Rather than cold raw. So we would just suggest cooked vegetables, and this plate could be in a form of a soup or a stew. It's just the visual is important to have half vegetables, a fist of healthy carbohydrates, a palm of protein, and then a thumb of fat. So it's well balanced. So you feel full from every single type of food, rather than just, rice and meat, or pasta and spaghetti sauce. It's well balanced. And
then the oppositely, there's a lot of people that will have zero carbs. They think, right? And then not enough fats either. And it's like, no, balance means, you take bits of everything, and you want to be able to do it, I think, over the long term. So it's literally not just in the period of, oh, I want to stop my periods from hurting, or, oh, because I'm trying to have a baby. Really, it's about something that you assimilate into your life as part of your lifestyle. And I always say, like, when it's coming to talking about your whole overarching lifestyle, it's not to be like 100% necessarily with it. There are going to be times where, for whatever reason, you're going to be in a place where you have no choice. Right? So you can stay away from, but it's hard to avoid it 100%.
100% is very challenging. However, when we are trying to decide whether or not a food is troubling somebody, we will often say, okay, take it out completely for a month to 3 months, and then reintroduce foods one at a time. Yes. So if we're taking away, for example, dairy and gluten and sugar and processed foods, and then reintroducing, we get to see at the third menstrual cycle what kind of impact it has. Because just as it takes, about 3 months to improve egg quality for women and sperm quality for men, because it's a 3-month process, that impacts that menstrual cycle on the third month. Yes. And then in general, like you're saying, in later life, like when maybe you're not trying to have children, at this point, you're trying to have healthy egg quality for healthy hormones, because your hormones come from your eggs and your sperm. So it's really important to keep oxidative stress low so that produce healthy hormones. And then later, so through perimenopause, menopause, let's say, for example, or postmenopause, we're not necessarily, well, I mean, we still make hormones from our eggs, but they're quiet and there's very low levels, right?
Mm-hmm.
So from our ovaries, I should say. So, and we're not ovulating anymore, but the oxidative stress, we still want to keep it low. We want to keep inflammation low. So if you had irritable bowel in postmenopause, taking out foods that could be inflammatory and reintroducing it to determine what foods are bothering you is really helpful. Like I've had patients, with, for example, conditions that sometimes are coexisting with endometriosis, as I mentioned earlier, like thyroiditis or rheumatoid arthritis, for example, and they take out the inflammatory foods and they feel so much better energy. Sometimes it's literally shifting to get the balanced plate. And they discover, you know what, I'm actually okay with gluten.
Right.
It's more that I was eating processed foods and my sugar content was high in my diet. So it's very variable. Some people really literally do have a big gluten sensitivity. And let's be specific about that too, because you can have gluten intolerance, which means you have celiac disease and your immune system is attacking gluten and then attacking your bowel, like auto attacking. Then it shortens the villi and then you don't have good absorption. You can't absorb iron, you can't absorb vitamin B12, and you often get diarrhea. But I've had patients with, for example, cystic acne, no symptoms in their gut. And we test them for celiac disease and they're positive. And then we take out gluten and then their skin clears up. It's quite amazing.
So interesting. Yes.
Yeah. Because really the skin is an extension of our insides, like our.
Yes. But that's exactly why I say, we don't just necessarily want to go by diagnoses because your body gives you signals. So for that person, it was the acne that is saying, hello, pay attention. And let's see what's, causing this distress and going and exploring the root cause. And when we get rid of that, then that is so super helpful, right?
Yeah, no, for sure. So exactly. Yeah, you're right. We don't want to be defined by our diagnoses. Even once we get one, it does sometimes help to understand what's going on.
Yes.
So I agree. We can kind of target and have a little bit of an easier time. So for example, if you did have endometriosis, it doesn't end at looking at, oxidative stress, reducing that and inflammation. We also want to look at the estrogen progesterone balance, and it's often an estrogen dominant condition. So we would kind of try and balance that out. So through nutrition, perhaps improving your body mass index. I know we're trying to do, look more at body positivity and love our bodies no matter where we are. It does have a big impact when you have estrogen dominance, however, to have a healthy body mass index and a healthy fat percentage. So one of the targets would be to drop weight to lower the chances of having estrogen stored up in the fat cells. And then there's less of that estrogen kind of affecting the inflammation, balancing it out. So that's one thing you can do. And then you can also, even use progesterone creams during the menstrual cycle, the second half. If someone's progesterone resistant, because some women with endometriosis are, that's not a good treatment, but you would find out pretty quickly because you would, within 3 months, you'd be able to determine if they were responsive to that. But it's not just a one fix all type treatment. The birth control pill works because really you're shutting down ovulation.
Yes, it's easy.
Right. So it's wonderful. And we often expect immediate results in our life because with conventional medicine, they are very effective with the treatments. However, there are lots of side effects that come with birth control pill. For example, mood swings because of the B deficiency that often occurs, and B vitamins are really important for tryptophan and serotonin production, which is our happy mood molecules, right? And you can get weight gain, and then of course you're not really dealing with the underlying issue. What kind of symptoms do you see, like our side effects do you see with the birth control pill? I actually had a patient recently, sorry to interrupt you, where she was on the birth control pill for 15 years and then her lining was thin. So doctors often don't recognize that as a complication, but your uterus lining can become thin and that can make fertility challenging for implantation. So that's another reason why you want to limit the 5-year consumption of birth control.
And in Chinese medicine, we say that it actually is drawing out your energy, right? So it can consume your yin, the female nurturing energy, which can be equated to that thin uterine lining.
Right.
And it can also cause stagnation. So because there's no movement, right? Basically, you're making your reproductive organs be asleep the whole time. And when you get your period, it's a false sense of it's like normal, but really you're not ovulating. Everything's shut down. So nothing is working. Right. When the pill first came out, I forget what year, they initially made the pill where there's no bleeds. And people were frightful by that. So then they said, you know what, let's allow women to bleed and then they'll feel better about it. But the point is not to get people to ovulate, right? So so it does nothing for your actual natural cycle, the natural rhythm. So for some women, when they get off the pill after a long time, their cycles don't resume for a very long time. Like myself included, it took me 2 years to get a cycle back.
You're on the pill.
I was on the pill, and when I decided, I thought, I don't think I quite like this. So when you're asking about certain symptoms, I certainly was highly bloated, and I had this voracious hunger all the time.
Me too. I gained like 30 pounds. I was also freshman. Well, they say 15, but mine was 30. Yeah.
Right. So, and I get that it's a very easy go-to thing, and it works if you're having menstrual
it works
cramps.
amazing. I mean, I used to be like cold chills on the floor, vomiting with my period. So thank goodness for the pill because it got me through university.
Right.
I didn't ovulate through university. It was wonderful. However, when I was finished university, I went to naturopathic medical school. I was like, you know what? I've been on this pill for 5 years. I took it for acne and irregular menstrual cycles and painful periods. But what am I on this for at this point?
Yes.
Like, why am I doing this? Right. So I came off with the help of my intern at the time, and my acne came back with a vengeance, but I did drop a bunch of weight, which was wonderful. And then I got it all kind of, recognized that. And actually at that time, I did not have a diagnosis at all yet. Right. Because the doctor didn't give me a diagnosis. She just said, take the pill. So I had no idea what was going on. And they treated me very well in naturopathic medical school without a diagnosis. My skin improved through better nutrition, like you're saying. Yeah.
Yeah. Right. And so, yes, so there's lots of things that you can do. There's no shortage of things that you can do at home.
Right.
And then with the help of someone like Dr. Tanya as a naturopathic doctor, TCM practitioner like myself, or all of our associates at Alive who are awesome. And, Chinese herbal medicine is really great with that, about hormonal balancing as well, and dealing with all the symptomatology and, really going through the root cause. So there's a saying in Chinese medicine, at least through one of my mentors, Dr. David Bray in Toronto. And he says, 1 + 1 = 4, meaning, you have one type of like acupuncture plus herbal medicine, and it's like exponential in effect. Yes. So, and I love that, right? 1 + 1 is 4. It's not 2.
Right.
So I'm like, that's awesome. So basically anything that you do will just amplify your results, and it just requires consistency over time. That's the key.
Yeah, for sure. And my favorite herbs, or I should say supplements that I love for endometriosis are pycnogenol, because I find that really helps with the pain. Right. And then I also really like N-acetylcysteine. I started using it when I read a small but still double-blind placebo-controlled study of this group of women who are on Lupron, a Lupron derivative. So Lupron is one of those medications that kind of shuts down the follicle stimulating hormone in your brain, so you're not ovulating, and so different type of mechanism to shut down the ovulation, so you're not producing the estrogen. And
which means wait
yeah.
Before you compare it to something else, and we did another talk with Dr. Ari Baratz about how women taking fertility drugs, oh my gosh, could I go into menopause? Well, Lupron is one of the drugs that people worry about, but it's really, as Dr. Baratz says, it's like a medically induced menopause, which is temporary.
A menstrual pause.
A menstrual
So it puts
pause.
you into a menstrual pause.
Yes.
And they compared it to N-acetylcysteine. which is a supplement that if you were overdosing on Tylenol, you'd go to the hospital and they would give that to you through IV because it regenerates your glutathione. And glutathione helps you bind up Tylenol and eliminate it and other wastes and toxins and, chemicals. And it happens to be a really good antioxidant. So you don't need to rub a lemon on your ovaries as you take N-acetylcysteine, right? And apparently it can help to reduce the lesions and the pain. So like reduce the growth of the lesion. So there's equal outcome. I thought that was amazing. And I was disappointed they didn't really continue to study it, because there needs to be multiple studies and then a review of those, like a meta-analysis of those randomized control trials in order to have enough weight on it to be a treatment option that's, mainstream, but still really interesting. And I find my patients benefit from it, and it improves, egg quality by reducing the oxidative stress, and as well as obviously the symptom outcome.
So what I would like to add, and this is the disclaimer version, right?
Yes.
Because you got to know when you're listening to or watching this, that whatever we say, the supplements that it's speaking about, you don't just haphazardly take it.
No.
And it's best to actually be under the guide of, a naturopathic doctor or someone that actually is well-versed in this rather than
I like to share the research behind the natural medicines that exist for different conditions, because it's exciting that they're actually studying them. It doesn't mean that we all go on every single one that we mention. It's very important.
100%.
Very individualized and customized, so that you don't have a health food store in your home.
Yes. And a lot of people do.
Right. Where you just don't take it. It's really important to follow through. If you have a lot of bottles in your home, it's time to wipe out your cupboard and start fresh and keep it simple.
I have a question. Mm-hmm. So the NAC, a lot of women will take it. Do you keep taking it when you get pregnant?
You can up to 12 weeks safely. Okay. They actually have done, there was another small study that said that it actually reduced the chances of miscarriage. However, I think that it has to do more with the background reason of why, when you're taking it in the first place, it just improves egg quality, but not because it actually anything really can reduce the chances of miscarriage. I don't believe
So the bottom line is that it can be safe during pregnancy. Yes. And would you go on the same dose, or would you lower the dose?
No, you can stay on the same dose until, because it's individualized, but it seems, there's no fear around that. Yeah. There's certain things for example, berberines that you're taking because you have polycystic ovary syndrome, and it's really good for blood sugars. And that's definitely something you would stop. The cool thing is that if you're on, let's say, vitamins or supplements, the placenta doesn't really develop until 8 weeks. So pretty much as soon as you get that first positive test, that's the time when you would, stop taking anything that the doctor tells you, or naturopathic doctor tells you to, stop taking at 4 weeks pregnancy, which really means you've been pregnant for 2 weeks, and there's no, it's not going to increase your chance of miscarriage, no risk. It's not getting to the embryo. Okay.
So we need to close this up, but before we do, I have one last question, because we're talking about changing diet and stuff. What if you're just listening to the this episode and you're literally just going into an IVF cycle? Is it okay to completely revamp your diet in midstream of something?
I think it's always best to get the advice of a doctor at that point. It's better to be consistent, not too many drastic changes, because unless you're guided through, I think there's no harm though to, when you're going through pregnancy, to say, I'm going to eat fruits and vegetables and foods in their whole form, right? You can't ever go wrong with having a balanced plate and eating healthy foods.
If you can.
Probably, right. If you can. Because if you're pregnant, you might be throwing up and wanting carbs only.
Yes, exactly. Yeah. There's the ideal. And then it's okay, what can I manage today?
100%. So if you try to catch those first 6 to 8 weeks pre-nausea, but the funny thing is, that's a whole other episode, but you have to eat in order to not get nausea. It's such a funny thing. It's I'm nauseous, so you don't want to eat, but you eat, and then the nausea goes away. So eating healthy is definitely beneficial. Get advice though, for sure.
Thank you. That is a really, that's really great advice, because, yeah. And you know what? We will totally do an episode on like, oh my gosh, like I just got pregnant. Now what? Because, you know, so many women have gone through like a miscarriage or never have been pregnant at all. And then once they get pregnant, it's not like everything is like, oh, now I can chill. It's, oh my gosh, now I have to make sure that it keeps going. And I may have even more anxiety, right? The anxiety never stops. So, you know, we want to cover all these things to mitigate the stress and the anxiety that's involved with all that.
And dairy, do we want to cover that really quickly?
Yes. Oh my gosh.
So
yes.
Dairy for some is completely fine. I'll often say, you know, cut milk, leave in cheese and yogurt. However, a lot of people are reactive to dairy. So in those people, for sure, take it out. The research says for endometriosis, dairy is fine, except for butter. So my usual recommendation that is if somebody is, you know, safe or they're fine eating dairy, doesn't impact them, they don't notice more inflammation, perhaps in their joints, or they're not bloated, they're not getting diarrhea, they would have maybe a low fat cheese and yogurt to avoid the saturated fats, which can trigger more inflammation. So it's very individualized. Research says it's fine except for butter, but the bottom line is you got to decide with somebody what works best for you, or challenge yourself, take it out for 3 months or a month, reintroduce it and see how it impacts you.
Right. And then when you have it, what is low fat cheese? Is it actually, oh, I look on the packages and it says low fat cheese, or can we guide them more through, is it sheep cheese? Is it goat cheese? You know, what do you recommend?
That's a good question.
Yeah.
So sheep and goat cheese are actually considered hypoallergenic in terms of the protein. So there's casein is the protein in one of the proteins. So there's actually 2 proteins. Maybe we should do a whole episode.
Exactly. I know. Like there's so much. Oh.
So which would it be? So you would compare, an easy way to do it is to compare your cheeses and see which ones have the lowest. But an example would be like a mozzarella or bonconcini, for example.
Sorry, they are better or not?
They would be lower fat. So like, and you might want to look for lower fat. And if you're lactose intolerant, you're actually looking for a lactose-free cheese as well. So there's sugar in dairy, the lactose, right, in milk. And then there's casein and whey. Casein is the only remaining protein within cheese and yogurt. When milk gets fermented to yogurt and cheese, lactose gets removed by the bacteria mostly. But there is sometimes a bit of trace of lactose in there when you read a container on yogurt. If there's no added sugar, but it says sugar on the label, that's sugar is coming from the trace amounts of lactose. So you may need a lactose-free version if you're lactose intolerant. If you're lactose intolerant, you may indeed be also casein and whey intolerant.
Yeah.
So then you would take out dairy completely.
Stay away from that. Yeah. And then you can do, like, if you love milk, then you can drink something like the oat milk, right?
Oat milk or almond milk. Yes. And omega-3s are really important as well. And trying to get omega-3, omega-6 balanced diet. So I mentioned saturated fats a lot. Omega-3s help to reduce inflammation. Saturated fats increase inflammation. Omega-3s can be found in fish and hemp seeds and ground flax seeds. So again, another whole episode.
Yeah, that's why I'm laughing.
Generally speaking, it's really important to have a balanced diet, and this can benefit everybody, not just those with endo.